All right. Hi, ICPA members. I'm Dr. Ian Shtulman, and I'm really excited to be bringing somebody very special today. This is Rebecca Dekker. She is a RN and a PhD, and she has, for the last several years, run evidencebasedbirth.com, which has been an incredible resource for myself and my practice, and I know for many of the ICPA members that are probably watching now. So I really wanted to bring her on. Rebecca, thank you for joining us.
Thank you for having me. It's definitely interesting, crazy time to
Yeah.
talk about maternity care.
Yeah, absolutely. Now, I wanted to just let people know. I know you have the book in your background, but I've got my copy here. Babies are not pizzas; they're born, not delivered. I loved how you really shared your experience and your vulnerability, being a nurse going through the maternity process. Not to get into too much detail, because obviously we won't want people to buy it and read it, but what made you get so inspired to shift your career into the evidence-based world?
Yeah, I was really inspired by my own birth experiences, particularly with the care I received from a community midwife, which I know chiropractors, refer to a lot of midwives, and a lot of midwives refer to chiropractors. So that's kind of a special relationship between those two professions. But my first baby was born in the hospital, and I had a pretty typical American hospital birth. I came in labor. My waters had broken at term, and I was told to get in bed and that I was not allowed to eat or drink. And I was hooked up to the continuous monitor. And then I basically laid on my back for the next 24 hours and had a very long, difficult labor. I had an epidural, and I was starving the whole time. They wouldn't let me get up and walk to the bathroom. They either made me use a bedpan or they catheterized me when I couldn't pee in the bedpan. And it just was a very long experience. It took me 3 hours to push my baby out. She was actually a pretty small baby, only 6 pounds, 8 ounces, but she was posterior, which is not surprising given that I was laying on my back the whole time. I also realized later that I think chiropractic care would have helped because I had mild scoliosis. My hips are kind of uneven. And I think there was probably, something holding her back from getting in a good position, but it didn't help that I was on my back the whole time.
No.
A couple of years went by and I just really started to think about what happened to me. During that birth, I was a PhD student. I had almost finished my PhD in nursing. And then I went on to become a nursing faculty at a large research university, the University of Kentucky. And I just started looking up all the research because I had access to it. I was faculty. I had this huge medical library. So I started searching all the research, and I basically found that most of what happened to me has been shown by pretty solid research, a lot of it randomized trials, to be harmful or not helpful.
Mm-hmm.
And I was really shocked because I was like, this is an academic medical center. Like, why are they giving me care that is so outdated? And then I learned that if I wanted evidence-based care, it was going to be really hard. And they had all these policies forbidding it. I was told by the nurse manager, like, we would never let patients do that. We're never going to change this. We're never going to change that. And so I realized the next time I got pregnant that the only way I could get the kind of care I wanted was to hire a community midwife and have a home birth. At the time where I live in Kentucky back then, nurse midwives could practice at home, but there were only a couple of them in the whole state. And we had certified professional midwives, but they were all practicing underground because they were illegal. They were not illegal, but they were not legal. They were kind of in this weird middle ground. So I did hire an underground midwife, but I did a lot of checking of references and did my background work. I had an amazing home birth, and the experience was just so completely different because from the very beginning, she practiced both on her, evidence-based care isn't just about the research. I mean, it also includes still using your clinical experiences and that wisdom and intuition, but it also includes the research. And from the very beginning, everything that I wanted that the research showed was best, like keeping me and my baby together, delayed cord clamping, laboring in water, all of these things, childbirth education, she was already recommending and basically did as her normal. So
Yeah.
I didn't have to fight for anything. It was just, this is how it's done. And after that baby was born, and he was 9 pounds, 2 ounces. It only took me about 15 minutes to push him out. It was a 12-hour labor. It was a very easy, smooth birth. He came out so fast. And that I attribute partially to the positioning, the fact that the baby was well positioned. I'd been receiving chiropractic care throughout that pregnancy based on my midwife's recommendations, and went on to have another birth with that midwife again 2 years later. But at my second child's birth, I was just so struck by the difference. Like when you experience those two like extremes, you realize how much needs to improve in our American maternity care system. And I just really wanted to get the word out that there's research and people should have access to it. So I started Evidence-Based Birth just kind of on a whim, thinking, well, maybe a few people will find it interesting. And within a couple of months, the website just took off. So it was just a little side project, a little blog. I was like, well, I'll review the research on this and that and just kind of share it with my audience. And it kept growing and growing until 4 years later, I ended up quitting my faculty job to do evidence-based birth full time. And that's what we do now. We have millions of people visit our website where we make research on childbirth publicly accessible. So it doesn't cost anything. It's not like up to date where you have to like pay to get to the articles. And it's been life-changing for me, and a lot of other people reach out to us from all over the world. We have readers in basically every country in the world. And so it's been incredible to see the need for it. So people really want this kind of information. They want facts, they want research, and they're also struggling with healthcare systems around the world delivering poor quality care to women. And we know, for example, in the US that maternal mortality rate here is much higher than other countries. The infant mortality rate, the newborn mortality rate, all of them are unacceptably high. And it's not because there's anything wrong with American, families. It's the system we're giving birth in.
Yeah, it's really interesting when you talk about how your two, the first and the second birth were so dramatically different. You followed the kind of mainstream clinical protocol that medicine and most OBs recommend. And even with a relatively smaller baby, you still had a much more difficult experience versus doing the midwifery approach and getting adjusted and all of the things that you've now learned actually are more supported in the evidence of how different it was with a much larger baby. I think that's such an inspiring story for people who feel like they want to do things in a midwifery approach, but they feel pressure to go by traditional obstetrics.
Yeah, I forgot to mention, it was even a vacuum delivery with my first.
Wow.
Yeah, that's how bad it was. And then my second and third, they both weighed 9 pounds, 2 ounces, both of them. And the third one, I think I only pushed for 2 or 3 minutes. So definitely had ample room in my pelvis. It just wasn't, it was more about the baby's position than anything else.
Absolutely. Something chiropractors recognize, all too
exactly.
Well. Why do you think that there's such a disconnect between what the evidence suggests or what the evidence shows is safer, more effective versus what's actually practiced in obstetrics in a traditional practice? Where's the disconnect? Why is that gap so large?
So I haven't seen any recent research on why there's a gap, but starting about 20 years ago, researchers were recognizing that physicians weren't always following evidence practice guidelines. And they did some research back then on physicians in particular, and they found that they didn't always practice in line with the evidence, number one, because sometimes they weren't aware of the evidence. It wasn't part of their education or their continuing education. Some of them didn't follow evidence-based practice guidelines because they didn't like them. They preferred the status quo.
It was less convenient, yeah.
Yeah, I mean, people like what they're used to. And then another reason was sometimes they didn't believe the research. And I've seen that quite a bit, especially with the research on electronic fetal monitoring during labor. There's a lot of research showing that it doesn't really do any good, not even with high risk labors. may lower the risk of rare newborn seizures by a little bit, but that's the only outcome they found to improve. And most of the research shows that it drastically increases the chance of having a cesarean without improving any newborn outcomes. So a lot of doctors look at that and they just say, I'll never believe that research.
Yeah.
Like they believe in it so strongly that they cannot like accept the research.
Yeah, I think what was interesting is a few years ago, I heard Jennifer Margulies speak at one of the ICPA Freedom Family Festival. And it was a really interesting talk about how with all of the use of electronic fetal monitoring, especially the continuous monitoring with ultrasounds, that more didn't mean better outcomes. In fact, many times it meant more intervention that really wasn't necessary. And I realized that there's a level of almost habit that they become, right? They become residents and they start to learn how to do things the way that their instructors did them. And it becomes a part of, what they've learned how to do. And it's really hard to break those habits, even when you're shown, right? We see research that we see that even when people are shown that their beliefs are not accurate, people have a really hard time breaking those beliefs. And obviously, obstetricians are no different than anybody else in that manner.
Yeah, we're all humans and we all tend to have our biases. And I'm sure you can say the same for chiropractors. There's things
Of
that,
course.
like a chiropractor would never want to change a way they do things, even if a study comes out. Maybe they would, but you're always going to find people who are resistant to change. That's every profession. You're going to find a certain percentage of them are resistant to change.
Absolutely.
It's just part of human behavior.
So what do you find in all of your research? What do you find is probably the most common procedure used in terms of perinatal care that is the least supported by the evidence?
Oh, that's a good question. I think I have, let me see if I can, which one is this that I want to show you? I have a PowerPoint slide I'm going to show you. Hold on just a second. And you can let me know if it's the correct. Do you see the whole slide or do you see the notes in the slide?
I see, I can see your, what you're seeing with a presenter view.
Like with my little notes on it?
Yeah.
Okay, let me try it again. I'll just try sharing the screen. Okay.
There you go.
Yeah, so let's see. I'm looking for, obviously, cesarean rates are high. Where you are in Florida has some of the highest cesarean rates in the US. They're the third highest.
Yeah, even the best hospital in our area, the one that's considered the most mother-baby friendly, still has a 42% cesarean
I
rate.
would say, actually, when you're asking the percentage-wise, there's a couple of things that are really, really common. One is that most everybody has repeat cesareans in the U.S. About so about 86%. So that's pretty high repeat cesarean rate. The lowest VBAC rate or vaginal birth after cesarean rate in the country is in Mississippi. A lot of bad outcomes in the Southeast, where I'm located.
Not a big surprise. Mississippi tends to be on the lower end of most metrics in terms of health, right?
And then you can see the states with higher, even Alaska is still, 25%. You could easily get to 50% if doctors were encouraging vaginal birth after cesarean, but most are not. The other thing that I think is really important is to understand that probably the least evidence-based thing we do in our country is the lack of midwifery care. So certified nurse midwives attend about 9% of births. Other midwives, which usually means licensed midwives or certified professional midwives, attend less than 1%. So it's about only 1 in 10 births are attended by a midwife. And that is like the exact opposite of most of the rest of the developed world. Yeah. And there's a lot of geographic variation. When your members who are watching this look at it, like you can see, like Alaska has some of the highest rates of midwifery care, followed by New Mexico, Vermont, Oregon, and New Hampshire. But then you look at the lowest rates. Look how low it is in Texas, Louisiana, Mississippi. Alabama and Arkansas are tied at only 1% of births are attended by midwives. And there is a ton of research that when you have midwives, when you integrate midwives into our legal system, into our medical system, there's more midwives, we have better outcomes, lower rates of interventions, and lower rates of preterm birth and newborn death. So that is probably the biggest problem our country has, is that midwives cannot practice fully. In most states, there's a lot of restrictions on midwives, and we don't have nearly enough of them. The field of obstetrics about 100 years ago kind of took over the field of childbirth in our country, and midwifery has never recovered from that. And that is a big problem, because when we need more midwives to lower the newborn death rate, to lower the rate of interventions, to increase the rate of breastfeeding. And you can kind of see, like, the lighter color states here have the worst midwifery integration. And you can see that a lot of those states, you can overlap that with other outcomes. This website lets you, and you can see, like, for example, this is newborn death, how the lowest newborn death rates happen in the green states, and how many of them have lots and lots of midwives.
Yeah.
But there's other things that are fairly common. You're talking about what are the most common non-evidence-based measures. One is not supporting midwifery care, not making that the norm. The other is electronic fetal monitoring, which is pretty much ubiquitous. So again, that's like 9 in 10 people have that. And the other thing that's most common is still forbidding eating during labor. That's about 80% of women in the year 2012 reported that, according to the Listening to Mothers 3 survey, they were not allowed to eat during labor. And then the next most common thing is probably being made to lie on your back during the actual delivery. And nobody ever suggested that I get into a different position. I pushed in the lithotomy position for 3 hours with that first baby. And to me now, it's just like, what were they thinking? You know, of course you'd move somebody around and shift positions to try and shift the baby. So it's kind of fascinating how they become people can be so stuck on one way of doing things that they don't see that there's another way. And that's, again, because we don't have midwives or enough midwives. That's why midwives don't do that. Like, that's not their norm, to tell someone to lie on their back unless there's a specific reason to.
Well, and that's a conversation that I have with my patients all the time. As I explain to them, I always ask them, what sort of experience do you want in birth? And many of them who tell me that they want a natural experience, I'd say that they should consider midwifery care, because their current, their OB is a trained surgeon. They're not trained to sit back and wait and allow the body to progress normally. Their go-to is to intervene. And midwives that I've worked with tend to be much more patient, much more supportive of alternative approaches, and really supporting a physiological birth, which I think is so vital to reducing all of these numbers that you're referencing.
Exactly. And it's not that there's not a place for obstetricians, and
of course,
we need trained surgeons to help those people who need it. And we need people who can help with high risk pregnancies and births, but it shouldn't be 90% of all pregnant women in the US.
Absolutely.
Having a physician. It should be, most other countries, everybody has a midwife. 100% of people have a midwife, and some people also have an OB. Because even in those countries, they recognize that even the highest risk women still benefit from the social support, the nutrition counseling, the emotional support that they can get from a midwife.
Yeah, I know that in many of my patients who aren't currently under midwifery care, many of them have to rely on our practice to give them a lot of the support that they'd otherwise get in midwifery care, as far as the recommendations on lifestyle and things that they can do to prepare themselves. So I know myself and many of our members really advocate for midwifery, as well as support from doulas. But until we flip that system around, right, so that we have everybody with a midwife and a small percentage of people with an OB who need him, what have you found to been the most effective way at sort of changing the approach that an OB might take in terms of the interventions that they use, right? So if you show somebody the evidence, as we talked earlier, sometimes it's not enough to challenge beliefs. What's a way that we can advocate for our patients and support our clients in convincing their doctor or having the doctors change a little bit, or at least have some leeway in terms of the approaches that they take?
Yeah, so I think there's like two parts to that question. One is, how do we get OBs to practice differently? And the second question is how to help your clients like navigate that system. I
Yeah.
think the best way to get OBs to practice differently is to start in pre-med and medical school,
Yeah.
and start educating students before they get into residency. Or you can try starting in residency. A lot of the most evidence-based OBs that I know were exposed to midwifery during residency. And it's just medical school and residency and pre-med are very formative years of their
Mhm.
career. And that's when they're going to form a lot of their opinions and practices and, their cultural patterns. And so I really believe in the importance of making a difference with students. So that's one thing. There, it's a little bit of a delayed effect,
Yeah.
but it works. Believe me, if you reach someone in pre-med or medical school, for example, as chiropractors, if you could talk to pre-med students, talk to medical students, they will have a completely different outlook when they graduate. If you wait till they're attending physicians, in most cases, I think it's too late to really make significant impacts on, I have met some OBs who really changed when they were attendings. But for the most part, the OBs that I know that are supportive of midwifery care and physiologic birth started that way in medical school or residency
Yeah.
by some exposure to midwifery. So that's the first answer.
Yeah. Just to comment on that, I had a pediatrician that I developed a relationship with, and he was a preceptor for medical students. And he worked out this arrangement with me where his medical students would come and shadow me for a few hours, at least, once during their time with him. And it was so interesting to see these future pediatricians have a completely different understanding of what chiropractic was. And many of them would comment about how much safer and less force was involved in our adjustments than their basic newborn exam. And you can see this like switch just flip for them. So I'm completely agreement. I think it's essential that we really start from people from before their education is really solidified into how they're going to practice.
Exactly. So the other part of your question was like, how as a chiropractor do you handle a situation when one of your clients maybe wants a physiologic birth, but they're in a practice setting or a hospital or with a provider that chances are not good that they're going to get
Absolutely.
what they want. There's a couple of options. Again, one, I feel like it's important to do that education before pregnancy.
Yeah.
Because once people are pregnant and they get attached to a provider, even if that provider is terrible, they're unlikely to switch unless they, really feel confident in switching providers. So I would recommend starting with any clients of childbearing age and or talking, or some midwives that I know even offer planning to conceive classes and stuff like
Mhm.
that. So reaching people before they're pregnant or before they have their first prenatal visit, like having a list of recommended providers and birth settings, like posted prominently in your office so that they kind of know, like, this is where we're pointing you, because once you have that first prenatal appointment, people feel reluctant to change providers. I have, though, had some success with people changing providers simply by sharing information with them. So in our evidence-based birth childbirth classes, our instructors will present the statistics for all of the hospitals in our community. It's part of our childbirth class. So
Mhm.
literally they will sit with their instructor and their classmates, and they will see the C-section rates, the VBAC rates, the breastfeeding rates, the episiotomy rates at every local hospital. And we don't judge the hospitals. We just say, here are the numbers.
Yeah.
And if the episiotomy rate is 10 times higher at one hospital, that raises a lot of red flags for some parents. Most of them don't even realize that there are safety and quality statistics of hospitals. So that's important. The other thing we do is we kind of go over red flags, things to look for in an appointment. So we say, if you feel like they're not listening to you, if they dismiss your questions, if they roll their eyes at you, all of those are red flags that you should consider going somewhere else. And then the other thing we do is motivational interviewing. So one thing I've found is that humans, including pregnant people, don't like being told what to do. So you probably won't have very good luck if you were like, listen, I know you want a natural birth, but you really need to switch providers because that doctor's a jerk,
Yeah.
And I've had clients have really bad outcomes. Here's the name of some doctors and midwives I recommend. Like, they're not going to do that. They're going to feel like offended, like you're inserting themselves into their decision, you're judging them. So instead we kind of ask questions, just kind of interview questions. So how do you feel about your provider? What do you think? Are they supportive? How do you know they're supportive? Have you talked with anyone who's had a natural birth with them?
Yeah.
And just try and what would it look like to you, if you were to switch, what would you think about switching to a provider that had better statistics with natural birth? That sort
Yeah.
of thing.
I think that's really important, because you're right. Once, especially as chiropractors who don't necessarily have the same cultural authority in terms of health, let alone birth, whenever people come to see us and they're already pregnant and they already have a relationship established with an OB, they have, they own most of the trust in that relationship, as opposed to them coming in, especially to see a new chiropractor that
They don't know you.
Exactly. And, I've taken a similar approach. I've actually done both, where I've just flat out told people that they were in a bad situation and it never worked out the way that I wanted it to. And what I found was, simply connecting with the parents about what they want their experience to look like, and have them get really in touch with that. Because let's be honest, most parents go into birth not knowing what they want other than a baby when it's all said and done. And so very few people have really spent the time necessary to connect with what their options are and what they'd like to accomplish. And therefore, they don't even know what questions to ask when they meet with their OB. So I always encourage people to sit down and really, learn what's available in the birth world and what your options are, and then have a conversation, like you said, and see not necessarily what the doctor says, but how they say it. Are they supportive of a birth plan? Are they supportive of delayed cord clamping? Do they dismiss it? Do they mock it? I mean, there are some OBs who literally just say, no, you can't do that. And they even make fun of moms for considering it. Those are big red flags. And I always tell people, if you don't get the impression that your doctor is 100% supportive of everything you want, that's a big red flag for you, that they may not, especially if you think about what happens in the middle of the night when a mom shows up to a hospital, it's less likely that the doctor is going to become suddenly more accommodating in those moments.
Yeah. I also teach a lot of people to ask more open-ended questions in their prenatal appointments. So, for example, instead of saying, how supportive are you of delayed cord clamping? I'd probably say something, I wanted to learn your thoughts. I've been hearing a lot about immediate or early versus delayed cord clamping. Can you tell me what your thoughts are on the subject? And just go in and find out their true unfettered opinion. Because if you say, I want delayed cord clamping, they'll be like, sure, we can do that. Because they want to please you. But when it comes time, they might be like, well, in their mind, delayed cord clamping is 30 seconds, So I would probably be like, okay, and how do you define delayed cord clamping? And I would just kind of I hate to say play dumb, but that's usually what we tell people to do.
That's great advice. That's phenomenal advice. And I think that's, and you're right. You're going to get more of the doctor's real opinion as opposed to what they just want to try to say to appease the patient.
Exactly.
So, I wanted to ask specifically about chiropractic. I know that you're a chiropractic supporter. Obviously, you benefited yourself. And I know you had one of our members, Dr. Elliot Berlin, on your podcast talking about the role that chiropractic plays in pregnancy and birth. One of the things that we struggle with as a profession is when we look at anatomy and physiology, we recognize how simple the premise is of chiropractic, especially in terms of how it supports pregnancy and birth. right? If the pelvis is able to move appropriately and there's less tension in the uterine and pelvic floor muscles, in all likelihood, you're going to support mom in being more comfortable. You're going to support baby being in the best position. You're going to support an easier birth with less intervention. And these are the things that we see clinically every single day in our office, but it's not necessarily easy to generate, published research, especially any sort of like double-blinded research. How can chiropractors document what we do and publish it, or what's the best way to make chiropractic's benefits in pregnancy better known and become a routine aspect of perinatal care?
So I am not as familiar with the educational pathways in chiropractic, but do many chiropractors go on to get their PhDs in research?
Not typically. I mean, most chiropractors graduate chiropractic school with maybe 1 or 2 classes in prenatal or pediatric care.
Mhm.
A small percentage will continue and do what's called Webster certification, which is through the International Chiropractic Pediatric Association. And that's the main educational course for prenatal care. Some go on further to do their certification in chiropractic pediatrics. I myself have done a diplomate in chiropractic pediatrics, but that's not typically how most people go about it. A lot of times they've just been in practice and they really like working with pregnant women and children, and they might have taken a couple courses, but the vast
But so when I talk about PhD, I mean like going on to get a research degree. Yeah.
The reality is very few do. Most of the research that we have in our profession are more like case studies or case series. There's a couple of full-time researchers. We have an amazing one with the ICPA. But for the most part, there's not a whole lot of funding, particularly in terms of like family wellness style chiropractic, whereas most of the research dollars have gone towards musculoskeletal pain because that's what insurance reimburses. So, it's kind of tough to be required or asked of a certain level of research that, the best research we have is really more in like a practice-based research network or, an accumulation of cases over the course of, dozens, hundreds, or even thousands of offices.
So how you get research to be done on your subject? I mean, money is part of it, but I think also it's growing up what I would call baby researchers who want to make that their topic.
Yeah.
So when I was in my PhD program, I was kind of like a baby in the field, and I picked a certain topic that I was interested in because I'd been exposed to it in my career as a nurse, and I went with that. And then you build on that topic. So when you become a researcher as a student in any PhD program that involves human subjects, you pick a subject or topic, and then you keep growing that into what we call a program of research, which is your specialty that you get funding for, that you do trials on, that you publish papers on. So it's really hard to get an established researcher to just kind of like drop their whole career and focus on a topic they've never focused on. So one thing you could consider is like, how can you encourage doctoral students in other fields to study chiropractic care?
Okay.
Another thing you could consider is, how can we as an association sponsor some of our own students to go on and get PhDs in other fields so that then they could come back and study chiropractic, do trials and research. So the nice thing about having doctoral students, new professors do studies is a lot of times it's part of their coursework to do a study. So there may be a little bit of cost involved in paying the participants to be in your study, but doctoral students are doing research out there, and they're not getting a salary for it. So you don't have that whole like salary issue. Sure. So I often encourage people when they want research to be done in a field to say, well, how can we get more baby researchers, young doctoral students involved in this? It may involve offering some kind of grant from a chiropractic organization where, say, we have $1,000 in pilot funding for a doctoral student who wants to study chiropractic care. And you would be surprised, as a PhD student, I'm trying to remember how much it costs for me to do my dissertation study. I did a randomized trial with about 120 people in my study, and I think it cost me like $2,000 or $3,000.
Okay.
It wasn't that much,
Yeah.
but I wasn't having to pay my salary. If
Yeah,
that makes sense.
it's interesting that you say that because a company or an organization that the ICPA has supported is the Foundation for Vertebral Subluxation, which has done just that, led by Dr. Christopher Kent and Matthew McCoy, as well as Christy Kwan for all of our members who recognize those names. They've done just that. They raise money and they've been sending chiropractors to PhD programs, MPH programs, to get the training to go out and do the research that we all recognize that we need.
Yeah. And I think it's one of those things where obviously, your field works. Like people come back over and over because they find benefit in chiropractic care. But whenever you talk, about advancing your field, getting more opportunities for funding, for reimbursement, for all kinds of things, having that research, it just kind of backs up what you do. So it is important to have research. And like you said, there's not a lot on chiropractic care and pregnancy outcomes. I found one systematic review on like pregnancy related back pain, but there's so much more that it, like you think about me and like the fetal positioning, or, what about the position of the baby at birth, or the length of the pushing phase, or the length of the labor in general. Can chiropractic care make a difference? We don't have any definitive research to give to people and say, this is what happens if you see if you're randomly assigned to a chiropractor. There's randomized trials, but there's also like case control study designs where that would not cost very much. You would just need somebody, a doctoral student who has able to get IRB approval and can study your cases of people who got chiropractic care, and then create a comparison group of matched people in the local hospital and like compare their outcomes.
And doctors, chiropractors, if this is something that you recognize there's a need for, it's really important that we start documenting what we're seeing in our patients, because Joel Alcantara, our esteemed research director, as well as Dr. John Edwards, have both been collecting this data and want to put together these sorts of studies that compare groups. And there's a need for it, but a big part of the problem is in our documentation process. If we're not making the appropriate documentation necessary to collect the data and have it be reliable, then it's almost impossible for them to do their job.
Well, and it probably has something to do with collecting birth outcomes and matching that up with what you're doing as well. I can see one example you might look to is the American Association of Birth Centers. They created a registry so that every pregnant woman who gives birth at one of the birth centers that's enrolled is prospectively followed. And then they can't compare them to hospital births, but they can say of everybody who seeks care at a birth center, this is like their C-section rate. This is their rate of not having any tears during birth, et cetera, which can be helpful when you're thinking, oh, do I want to go the birth center route? Oh, look at their great outcomes. Like, I think I might try that.
Yeah, that's great. And I think that's really important because when we look at, for instance, I mean, the literal textbook on obstetrics defines dystocia as, directly related to the power of the uterus, the positioning of baby, and the biomechanics and movement of the pelvis. We know from a chiropractic perspective that we influence all three of those things, which is why the clinical outcomes we see in our practice make so much sense. But it's not enough anymore to just look at the basic sciences and then extrapolate what we do and say this is how it works. We actually need the data, and I think it's so important, right? If we ever want a chiropractic handout on your website, it's incredibly important that we get the data on a large scale basis to make that viable, because there's some evidence, published research showing like a control group versus pregnancy, that pregnant women who were getting adjusted had a 30% reduction in their pelvic floor tension. That's great, but a small group in in a pilot study is not the same as birth outcomes in 10,000 women, which is something that we could do if our entire organization got together and really put the effort into making that a reality.
Yeah, exactly.
So I'd be remiss if I didn't talk about the topic of the week, coronavirus. I know I have been very well informed thanks to all of your efforts and your team's efforts to put together some amazing data for the evidence-based birth community that you've developed. What is it that as chiropractors, many of whom we're still open, we're still seeing patients, we're strongly advocate for the role that chiropractic has in reducing stress and strengthening the immune response. What is it that chiropractors need to know about coronavirus in terms of supporting our pregnant patients and young families?
Yeah, that's a great question. So there are a lot of issues that pregnant parents around the world are, I would say, panicking about right now. There's
Yeah,
a lot of anxiety. My field of the field of childbirth seems to be really rocked right now with uncertainty and fear. Um, there's a lot going on. Most hospitals around the world are starting to ban doulas, so
yeah,
that is affecting your clients who are pregnant. One thing that I'm continuing to do is to continue to tell parents to keep their doula, because they're going to need that person to navigate the system, especially if hospitals start
absolutely.
closing. And also, a doula can labor at home with you for as long as possible. You can get to the hospital pretty late in labor and spend as little amount of time there as possible if you have a
Just
doula.
one of the things, my business partner is a doula and she runs a group of doulas in childbirth education. And one of the things that we've talked about is during all of this, that the prenatals that the doulas do should be more focused on educating parents and giving the partner hands-on support on how to support the laboring person, as well as spend more time at home, and that way you can even do like video. We've had a couple clients who have done video doula,
Hmm.
where they've done a Zoom just like this, and they put the laptop on in the corner of the room, and the doula is there to support emotionally and talk through the partner about how to do some of the skills that they've
Yeah.
previously taught them. And that seems to be really helpful. I mean, it's not as supportive as the real thing, hands-on in the room, but it's still incredibly supportive. And honestly, I think that what's happening in some of these hospitals, not even allowing the partner in, is just completely inhumane. And it's heartbreaking to see women have to go through that.
Yeah, so that's the first step, is the hospitals ban doulas, and then it seems like they want to keep making things more and more restrictive. So once they get more cases, then that's when we're starting to see the ban of partners. And a lot of parents around the world and in the US are extremely anxious right now about the thought of being forced to give birth without their partner. And it's a violation of your human right.
Yes.
So the World Health Organization does say that it is a right to have a companion of choice present during your delivery. So um, I think hospitals, it's like a knee-jerk reaction to remove the partner. I think the partner is seen as a vector and a potential contaminant for the staff.
Yeah.
Part of this is due to the fact that the staff, there's severe shortages of personal protective equipment, and um, there's no testing. So in an ideal world, you could just have a rapid test. You could test the birthing person, their partner, when they walk in the room, and even the doula, know if they're positive or negative, and then you know what you're dealing with, you
Yeah.
know. But because we don't have testing, everybody's kind of, quote, a suspect, right? So they're afraid of staff getting sick, because if we start having staffing shortages, which in Italy, 1 in 10 victims of the virus was a healthcare worker, that's what's creating this fear in the hospitals. The problem is, if we start having staffing problems, nurses are going to be short staffed. It's even more critical that you have a partner or support person or
Yeah.
companion in the room to act as a safety net. So that's going to continue to be an issue over the next month. I can already see that even those hospitals that say right now your partners are allowed, overnight they could change their policy. And what I'm seeing is parents trying to figure out, well, what do I do? You know, for many of them, I'm encouraging them to reach out to their hospital and their government officials now, before partners are banned.
Yes.
For example, in my local community, my sister's a doctor. She has a contact with the director of infectious disease at her hospital. So we took my PowerPoint handouts on the issue of banning partners and like sent it to them, like so that they would have the info, trying to like get ahead
That's
of
great.
the problem.
Yeah.
A lot of parents are considering switching to a freestanding birth center or home birth provider,
Hmm.
which is kind of fascinating because even people who maybe, like, for example, a mom really wanted a home birth, but her husband was really reluctant and said, no, I don't feel safe. Now, all of a sudden, risk perceptions are changing. They're like
Yeah,
realizing, well, hospitals might not be that safe. So, home birth providers, their phones are ringing off the hook. That's also really affecting them because they don't want to get infected either,
sure.
or not all at the same time. And then, um, virtual support is having to become an option. Early discharge from the hospital is becoming common, whereas it
Hmm.
used to be you had to fight if you wanted to go home at 24 hours with your newborn because the pediatric department like doesn't want you to. Now
Yeah.
they're like, go home, you can go home, see you later. But the short staffing is going to be huge. I have already started hearing reports in the US of women being turned away from hospitals in labor. Somebody told me yesterday that somebody was turned away from 3 different hospitals and ended up having to drive quite a ways in labor. So just because
Wow.
you have made all these plans to deliver at a hospital does not mean that you will get to give birth at that hospital. So we need to start like prepping parents for the fact that they might be not knowing where they're going to birth until the day of.
Yeah.
Um, and typically there's a federal law that protects you from being turned away from a hospital in labor. It's called EMTALA, EMTALA. But it's my understanding that when there's a state of emergency, as such as which has been declared by the president and the governor in your state, that hospitals can apply for a waiver to turn people away.
Wow.
So it is possible that women won't get what they want. We're planning. Um, and that's why so many of them are starting, I think, to turn to home birth options. Prenatal visits are turning into telehealth visits. A lot of them are being canceled entirely. Lactation support is suffering because you can't have personal lactation support all the time. And that's having to go virtual. And then you think about the whole issue of postpartum, of going home from the
Yeah.
hospital and not being able to have professionals come care for you. Family can't come care for you. um, Mental health services are an issue. And then not to mention, if you do become infected, even with a mild illness, um, the chances are really strong that the hospital will try to enforce the separation between you and your baby. So there is a lot going on in the
Yeah.
field of childbirth right now that pregnant families are worried about, which is why I
From
think it's even more important that as many families as possible get a virtual doula or somebody that can like help them navigate the
yeah.
process.
And I think for our members, it makes what we do just as, if not more important than ever, because we know that people are more stressed out emotionally, and chiropractic helps shift people from that sympathetic to a parasympathetic state. And we know that what we do helps to minimize intervention in birth and helps improve outcomes, which can help these women not only have less time in a hospital where they would get subjected to intervention that they don't want, as well as allow them to go home and be with their family in an environment that's feels safe and comfortable. So I think from a chiropractic perspective, it's even more important for us to really talk to our patients about the role chiropractic plays in helping them stay healthy.
And you
Uh,
might need to think about, I don't know what the state by state issue is, but I heard our governor in Kentucky say something about closing down chiropractic
I
offices. Is that
believe Kentucky is the one state that has specifically done a line item about chiropractic. I
like
know.
who's allowed to open and who's not?
Yeah, I know that there are other states that have said, essential healthcare, but they don't specifically say chiropractic, and they do talk about how if a delay in care would, have negatively impact a person's, health, then that's deemed essential. And so many chiropractors, including myself, view what we do as essential, and we're just taking proper precautions to make sure that we're keeping people safe, not only our teams, but also our patients throughout the whole process.
Yeah.
Um, speaking of the different policies that are happening, and we talked earlier about the gap between what the evidence says versus what the practice is, what is it that we should know about how coronavirus, COVID-19 influences pregnancy and, potentially an infant?
Yeah, so the research is emerging, but there's mostly so far no evidence of parent to baby transmission during pregnancy, although I believe one report just came out of a possible vertical, they call it vertical transmission, which I haven't looked at yet, but I'll know by next week what they found. And, I think the good news is that people who are pregnant are not more likely to catch the virus than a regular non-pregnant person. They're also not more likely to have severe illness. They have about the same chance of having severe illness as someone who's not pregnant, which is different. Both SARS and MERS had a very high mortality rates with pregnancy. Up to 27% of women who got some of those diseases died from it. And so far, as far as I know, there's been no maternal deaths due to the COVID-19, but some people have been severely ill and pregnant. And there's also a potential link with preterm births, probably because doctors had to do an early C-section because the mother was so compromised that they wanted to get the baby out.
I've noticed a lot of fear that has led to a lot of induction and cesarean.
Yeah, and so that's not related to the infection itself. That's another what I would call a downstream implication, is that people are terrified that the hospitals are going to deteriorate, which they very well could. So I think that is definitely something some families are considering. And we know that research on elective induction shows that it can be done safely with low C-section rates. But the problem is, if you're in a state like Florida with a really high C-section rate, and doctors have probably really high C-section rates with inductions, that research doesn't generalize to those situations.
Gotcha.
So there are certain hospitals in the country that can do an elective induction and do it safely and with a good chance of a vaginal birth, but there's lots of hospitals that don't. And when you think about the stress that the healthcare staff are under, they may be less inclined to support a long induction. And we know that inductions are longer than a spontaneous birth. So they might be more quick to call it a failed induction and go to a cesarean if they're under pressure from the pandemic.
Which ironically makes it even more important to have the support of a doula and partners by your side.
Yeah, although it's hard, because if you're induced, then again, you probably won't be able to have the doula physically present with you.
Exactly.
Whereas if you have a spontaneous birth, the doula can stay with you and your partner. I've even heard reports of people laboring in vans and RVs, like outside of hospitals before they go in.
Absolutely.
Yeah.
Well, I really appreciate you taking the time today. I know you've been very busy this week. I wanted to find out for our members if they really value the conversation that we've had today, and they want to provide access to their patients of the most up-to-date summaries, and especially plain language summaries, so to speak, about the research that you and evidence-based birth do such a good job of providing. What's the best way for them to get involved and to have access to some of the best information that you have?
Yeah, so definitely you could tell your clients just to go to evidencebasedbirth.com and on the main page to sign up for the newsletter, because that's, as soon as you do that, you get access to all of our free one-page printable handouts, as well as all of our research updates, especially with the COVID-19 crisis. We're releasing a new research update every Monday to our newsletter subscribers, and that's totally free. We do have your members might be interested to know, we do have something called the Evidence-Based Birth Instructor Program, which is professionals around the world it's an application thing where they apply, and if they're accepted, they can enroll, go through training, and then actually teach our workshops and classes and offer special parent online resources to their clients. And we do have, I think, 4 or 5 of our instructors out of about 200 are chiropractors, and we'd love to have some more. So if any of you are really interested in, the next round doesn't start till August, but it's never too early to learn more about the program, so you can be ready when the application's open. Just go to evidencebasedbirth.com instructor, and that should
Yeah.
take you to the info, or you can email us at info@evidencebasedbirth.com to just like make sure you're on the waiting list and stuff. So
That's great. Yeah, I know I'm a professional member of evidencebased.birth.com, and I really appreciate the webinars that you host and the live events and just the the amount of information that I've been able to have available to our patients in very convenient, easy to read handouts for them. Saves me a tremendous amount of time, and I feel confident knowing that I'm giving them the best information to help them really make an informed decision for their family. So, just want to give you a plug that if anybody finds this helpful and wants to become a professional member, I know you have that available as well.
yeah, we have the membership, which is continuing education. We also have our instructors. They love teaching in chiropractic offices. So if you have like a teaching space, they can offer our workshops
Yeah.
there, which is a great resource for your clients. Obviously, in-person stuff isn't going to be happening right now,
No.
but we've moved all of our workshops and classes to virtual for the time being. So
Great.
yeah.
Well, I appreciate it. Thank you. So any lasting words for the chiropractic profession?
No, just thank you for what you do. And we need more chiropractors out there who provide those prenatal services. And it made a huge difference in my birth experiences. So I just wanted to say thank you for the work that you do.
Well, thank you, Dr. Dekker. I appreciate the time.
All right. Thank you.